So I kind of miss teaching, so I figured I'd do something a little fun here. Now I know with ECG, some people are just absolutely amazing at it, and some people do just fine with it, but it takes them a little bit longer. Well, what I'm finding is that, after the MCAT, we just kind of all threw our physics, to the wayside, and we were, dancing and all joyous because we'd never have to see physics again. But I think it's coming back to bite us because at least the basics of ECG is all that second semester physics. So I wanted to start with two things here, and that's vectors and current. And just starting with current first. Now, as we remember from physics, current has that requirement of a moving charge. Without that moving charge, all you would really have is a potential. So one thing that Peterson was showing us was taking, let's say, a muscle cell fiber, whatever, or a series of them, with the outside having a more positive charge. Now, I'm not going to show the negative on the inside because when we do ECG, we're not sticking probes inside the cardiac cells. To me, that just would hurt. And so we're just going to look at the positive charges. Now, the more positive side here, which is outside. Now, what we have here is something that's just resting. Now, how much current do we have here? Well, if you said none, that would be right because there is no net movement of charge here. It's just kind of sitting here. Kind of think back with potential energy and kinetic energy. Potential energy is like if I had this marker above here, it's just sitting here, nothing's happening, right? Once I released it, that's when you had your kinetic energy, right? Same kind of concept here, right? So let's say this muscle fiber has action potential that starts. So what we have is we have a reversal of charge here. Now this is just a snapshot here, but this is an action potential that's actually moving here. Well, now because we have this change in charge, we have a movement of charge. As you might guess, we have current here. Okay, and by the way, of course, this is depolarization. Okay, now for convention, what we're going to do is we're going to take an arrow and say that the head of the arrow is positive and the tail end is negative. Now what I'm going to do here is I'm going to put the negative with the negative, positive with the positive. Since there's movement of charge, this is what we get. Okay, now as the action potential continues throughout this muscle fiber, we keep switching until we finally get to the more negative charges on the outside here. And I guess we can call this depolarized rather. And I can't spell, that's why I'm in med school. Okay, so anyways, how much current do we have here? Well, if you're saying that this almost looks like the resting over here, well, you'd be right. There'd be no current here because there's no moving charge. It's just sitting here. Okay. Now, as we know, we get this case where we get repolarization. Now, repolarization in cardiac cells actually go in the backwards direction. Why? I don't know. Look it up on Wikipedia or something, but it just does. Now, the action potential wave is going this way, whereas up here it was going this way. But note that when we take my little arrow here, I'm going to put the positive with the positive, negative with the negative. Now notice that this repolarization wave is going the opposite direction of here. Well, we're not going to pay attention to this. What we're going to pay attention is to this. Okay? I think this is where some people got confused. This was when Peterson was, wearing that positive and negative thing on his chest and back, and the whole point that he was making. So, does it make sense? Actually, it really doesn't matter if it makes sense. The biggest thing is this is the convention we're going to use. If you can accept that the head of the arrow is positive and the tail of the arrow is negative, this is going to work wonders. Okay. So, the next thing to kind of look at is looking at how this vector this movement of current, if you will, relates to leads and how we're going to view this. Okay, so here's my arrow indicating our movement of current from negative to positive. Now here's a lead here, okay, and this is what I'm going to use. Now we've seen a lot of where lead is like this, and then we'd have something like this, and he would say, well, is this positive or negative? And we're like, wait, what are we talking about again? Well, if you remember from physics, if I plot a vector on a graph, this is x and y here, right? And this is a vector here. Well, one thing that we could do is separate this into two individual components. And what I could do is then look at just the x component of this vector. Okay? That probably sounds pretty familiar, right? Now, one thing I've noticed, this vector I drew, as in comparison to the x-axis, this is positive, right? Because it's pointing towards a positive direction. Okay? Now, notice that if I do this, okay? If I break this up into vectors here, or components rather here, this vector in comparison to the x-axis would show positive. However, when I compare this with the y-axis, it's actually negative. This is the reason why we can see in, let's say, lead 1 a positive deflection, but yet in AVL it's negative. We'll kind of talk about that here more in a moment. Let me grab my sheet here. Now here's my little fake heart diagram. Bear with me here. This is the best drawing I can do. Okay. Now what I'm going to do here is I'm going to draw a little person here. Okay. This is our little model. Again, this is why I'm in med school, not any kind of art school. Okay, lead 1, as you guys know, go from the right arm to the left arm. Lead 2 goes from the right arm to the left leg, and then lead 3 goes from the left arm down to the left leg. And the positive minuses are as I indicated, or put here. Okay, so what we're going to do is we're going to pretend that this is my lead 1 here. Okay, now what I'm going to do is I'm going to use this arrow as the movement of the current as it goes through the heart as it fires. And we're going to basically predict what the ECG will be based on this. So what I'm going to do here, and I'm actually going to bring this down here just to make it a little bit easier. Okay. So SA node fires. This is the direction we got going here. Now the question I have for you is this positive or negative? Well, you can see that the arrow is mainly pointing towards a positive, or another way to look at it is if this was a vector, just as I had earlier, right here, it would be positive because this is down here looking like this. Now, we go through the atria, right? It's completely positive. So, what would the first signal look like? It would look like this, right? Because it's positive. Now, we go through, after a pause through the AV node, through here, and it's still positive, right? Because it's pointing towards the positive direction. That's where we get this from. Okay? And then of course it travels through the rest of the heart here. Now the thing is remember, repolarization occurs backwards, right? Through the ventricles here. Now, even though it's occurring backwards, it's going backwards like this. Now notice that during this whole entire time of this moving backwards, it's still pointing towards a positive side. Thus, That's the reason why the T wave is positive. Okay, so let's go ahead and look at lead 2. So I'm going to put lead 2 just like this. Now, SA node fires, we get this. Now note that the axis, all we did is we shift the axis over here. But this is still positive because if we take this vector and break it up in components in comparison to this, it's still positive. Goes through here, pauses at the AV node, goes through here. This is very, very positive, right? It's almost like parallel right now. Now if you look at like a ECG, I had one around here, I can't find it. You'll notice that lead 2, at least it seems like, is often very, very large sometimes because this lines up. Now if it's not, that means some other lead is more aligned with it. Okay, hopefully this makes sense. This goes through here, repolarization, it's still all positive. Okay, so now let's look at the other leads real quick. So I'm going to take my person here and draw them again. Okay. Now, the other leads that we have is AVF, AVL, and AVR. What that's saying here is that if I take a bigger person here, and I'm going to look at AVR here, and what I'm going to do is I'm going to put a plus here, okay, and then a negative here and here. Now, since there's two negatives here, I'm going to take the average of them, put them here, and then take this and do this. Now, if you notice, that's why AVR is kind of shifted towards it like that. Okay, AVL would have a positive here, the two negatives here, and a direction going this way. AVF would have a negative here, here, and a positive down here. Average these two negatives, and you get a line that points straight down. Okay, so let's go ahead and take a look at what AVL would look like. Now AVL, if you remember, is pointing towards this shoulder right here. So plus, minus, minus. So this is going to be my axis that we're going to use here as we do this. So the SA node fires, bam. Well, which way is this firing? Pointing right now. Well, let me turn it a little bit more. Well, this, if we transpose this, would give us actually a negative component, right? If I turn it more like this, it would make sense, right? All I'm doing is shifting it just right here. Negative component. We go through the AV node after a pause. We go down through the Purkinje fibers here. Well, guess what? It's still a negative component. We go through repolarization this way, still a negative component. If you look at your ECGs, you'll notice that AVL and AVR is probably negative. That's why. Okay. So the other leads to actually look at is V1 through 6. Okay. Now, the whole point of these leads here were to take the person and look at the heart in this plane. Well, what if we want to look at the heart in this plane here? Well, that's what we have here. Now, Peterson has a much better drawing in his packet. And what I represented here with the orange is the chest wall, like a rib right here or whatever. And this would be slicing through a person like this. Now, how this works is V1, V2, V3, V4, V5, V6 is essentially all positive leads here. Positive, 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 positive. And what we do is we take these and go through the AV node. And then somewhere on the opposite side of the AV node is where your negative lead would be. So I'm going to kind of do the same thing here. V3, same thing. And hopefully you get the point by now. And these are all negative over here. Okay. Now what this allows us to do is we get to actually view the heart from basically different angles. we're basically kind of moving around and we can see what's going on at any given time. Now, what you'll notice though is that V1 and V2 is, if you want to look at it this way, is looking directly at the right side of the heart, right here. As compared to V5 and V6, it's looking directly at the left side of the heart. Where V3 and V4 is looking right down the middle at the interventricular septum. So when you look at your arrhythmias, you'll see like a left bundle block and right bundle block. Well, I don't think he notes this in his packet, but a quick thing online, or if you read this book here, they kind of talk about it. You'll notice that for left bundle block, you'll see some things going on in V5 and V6, whereas in V1 and V2, you'll see, actually, it'll look like this, where you have like a R and R prime. It's really kind of funky looking. So that's what's going on with this. So I could see him asking a test question where he says, you know, you're a resident and your attending says everything looks normal except in V5. What would that probably indicate, just based on that information alone? Well, I think reasonably it would say that there'd be something wrong with the left part of the heart. Okay. Now, how does this actually correlate? Now, if you look at V1 and 2, a lot of times they're upside down on the ECGs. And I have an example right here. Okay, we're V3, 4, 5, and 6. I'm not going to do this, but if you take your little magical arrow, like I did here, you'll basically find that it's the exact same thing as what we did earlier. Now do note that this is a different cross-section than what we were looking at over here. Remember, this is more looking kind of up and down, whereas this is kind of cutting the person in half. Okay. I really kind of hope this has helped some people out here. The one thing I was going to do real quick is like one kind of arrhythmia that kind of help explain the vectors anyways. So what could be a cause of having inverted P wave? So let's say something that looks like this. Okay. Well, there's a few things that I've seen that can cause this, but we're going to use one example just to kind of prove a point here. Okay. So what I'm going to say is, what if there was something that was causing this to fire here? What would happen? Or what could happen? Well, let's think about this. Pretend that this is a pool, okay? Now the SA node, as you see, is in the far corner here. If I would take a pebble and drop it here, what would happen? You'd get a wave that would go through the pool like this, right? It'd hit the walls and then come back, kind of like depolarization and repolarization, right? It would just go one direction and go the other direction back, right? But what would happen if I dropped the pebble, let's say, right here? Well, you'd still get the wave going here like this, but you would also get a wave going here like this. Would you agree with that? Well, of course. Okay. So let's say we do have an issue where this fires instead of the SA node. Well, this is going to fire, and then you're going to get the impulse going this direction instead, right? Because it's going out towards here, causing depolarization of the atria. So if I was looking at lead 2 here, okay, and this fires right here, what would you get? Well, you'd get an inverted P wave. Now notice that here, when this fires, it's going to go through and hit the AV node, it's going to pause, and then go through here, and it's going to look perfectly normal like it did earlier in a normal heart. Repolarization the same way. Make sense? Okay. Well, I hope that quick little review was somewhat helpful. If it wasn't, then I'm sorry I wasted about 15 minutes of your time. If it was helpful, then awesome. I'm happy.